Vina, and I'm the speech pathologist who was interviewing Jimmy.
Hi, I'm Alia. I'm the speech pathologist that was interviewing the parent.
I'm Rachel, and I'll be putting in some commentary.
I'm Vandana. I'm the 11-year-old male client, Jimmy.
Hi, my name is Hessa, and I'm Jimmy's mother.
I'm Ariel, and I'm also putting in commentary.
Hey, nice to meet you. I'm Alia.
I'm Sophia, and this is my son Jimmy.
Hi, Jimmy. So how have you been today?
I'm good. I just finished work, and it's been a really long day.
Oh yeah. So what do you do for work?
I work as a receptionist in the morning, and at night I work at Coles.
This was an informal way of gathering information. Traditionally, this information would be asked on a physical patient demographic or case history form. However, it feels more natural to obtain it by small talk for an oral interview as such.
So Jimmy, you can have a little chat with your mum, and then when we're done, you can come back. So I'm just going to ask you a couple of questions. I'm going to start with your pregnancy and birth history. So first of all, how many children do you have?
I have 2 children. I have Jimmy and his older brother Tim, who's 16 years old.
Okay, and do you remember Jimmy's birth weight and height?
He was 2 kilos, but his height, I don't remember it.
Yeah. And was he born prematurely?
Yes, he was born 3 weeks early.
And did he have any complications during birth?
No.
And any complications after delivery?
No.
And did you use substances while pregnant?
No, I wasn't on any medication.
We did include the question about drug abuse. After a lengthy discussion, however, on its appropriateness, we felt it would give us important information in potentially explaining the child's present state. Ideally, the mother would write this information down, which would make her feel more comfortable than saying something like that out loud. In future practice, we would be careful around such questions and topics.
Yeah. And did he have any congenital concerns?
No.
And just some questions about his developmental history. So when did he first start babbling?
I have this written down somewhere. At 6 months, that's when he started to babble.
Okay. And when did he say his first word?
At 11 months, and I think his first was Dada.
Oh, okay. And when did he start putting 2 words together?
He was 2.5 years old.
And when did he first begin to speak in sentences?
At 4 years of age, that's when he could start to use more complex sentences.
Yeah. And did he have difficulty with chewing or swallowing?
No.
When did he start to dress himself?
When he was around 5 years old.
Yeah. And were there any areas in which you could have encouraged more communication?
I guess I regret being too overprotective of my son. I should have allowed him to socialize more with other kids when he was younger.
We believe that this section of the interview was very important in gathering developmental milestones to check whether he's been typically developing up until this point. It's important to gather this information right from birth because any developmental delay that occurred early on can affect later years. The last question we asked about encouragement, in hindsight, was probably not entirely appropriate or necessary. We were essentially asking her about her parenting skills. This may not be something she's entirely comfortable sharing. However, it is information we would prefer her to offer up herself. Next time we would probably leave a question like this out.
And just in regards to his medical history, does your child have any history of auditory issues?
No.
Yeah. And has he received any therapy for any other conditions previously?
No.
And is he currently on any medication?
No.
We also think that we could have included a question about any therapies or therapists he's currently seeing rather than just past history. This question is important to ask as often children may have other medical issues and have been seeing therapists and doctors for a large part of their life, which can potentially make them therapized and therefore would affect the way that they interact with a speech pathologist and how we would then plan our treatment.
Just about his family information. Does anyone in the family have any learning difficulties?
No.
No? Yeah. And who are the key adults in Jimmy's life?
Myself, his school teachers, his older brother Tim, and his grandparents.
Yeah. And as compared to Tim, what is Jimmy's language development like?
I guess Tim was reading more advanced book at his age, and also he had more varied vocabulary.
Yeah. And who does Jimmy live with?
While I'm at work, his grandparents comes over and they look after him.
And does he hear or speak any other languages?
No, but my parents, they speak Spanish to him and only limited English.
Ideally, this information would be elicited naturally from the parent or outlined on a physical client profile form. However, if this does not occur, then we'd have to ask it orally. For a child of Jimmy's age, family is still such a central aspect of his life and has a huge role in shaping his communication. Considering this, we believe that such a section of the interview for a child deserves to have quite a significant amount of questions in comparison to that of what an adult client interview would have.
And just some questions about his academic performance. So what has Jimmy's teachers said about him?
Jimmy's teachers, they expressed their concerns about Jimmy's attitude at school. He's not willing to participate in classroom activities, and I believe he's falling behind his peers in English class.
Yeah. And how is he doing with regards to his grades?
His math grades are excellent. It's above average, I think. But his writing skills are lacking.
Okay, and how were his NAPLAN scores? Were there specific concerns with his literacy?
All the results, they were below average.
And what subject is Jimmy good at or not good at?
Jimmy enjoys his IT class, but it's just English that he struggles with.
Has Jimmy's teachers expressed any concerns about his classroom performance?
Yes.
And does Jimmy receive any special services?
Well, his school, they provided him a specialist education assistant, but that didn't help him as much as we hoped it would.
Yeah. And what effect has the problem had on Jimmy's daily life at school?
He tends to be very quiet around a large group of students, and he prefers to only socialize with the people he feels most comfortable with.
Yeah.
Generally, for a child, we would not want to be asking so many questions about academic performance. However, we thought it was important in this instance because of the mother's specific concerns about Jimmy's learning and impending high school transition. The question regarding special services is critical to understanding what help he has available to him at school or has previously utilised. For example, if Jimmy had already been seeing a specialist education assistant at school, which was not helping, then that would affect our assessment and intervention. We would ideally like to be able to contact this person as they would have insight that the parent and the regular teacher may not.
And just some questions about speech, language and hearing history. So has he had a hearing test?
Yes, and the results were normal.
Yep. And has he had a vision test?
Yep, and it was normal again.
And what do you see as Jimmy's most difficult problems in terms of speech when he's at home?
He hesitates a lot.
Why have you brought Jimmy in today? What are your concerns?
I'm concerned that Jimmy isn't developing the normal writing and reading comprehension skills that are appropriate for his age, and he's going to be struggling at high school if he continues to have these kind of problems.
Yeah. And when did your concerns about the problem first arise?
I didn't think too much of it, but it was last year when he first got his NAPLAN results. That's when I knew that I had to do something about it.
Yeah. And is Jimmy aware of or frustrated by any speech-language difficulties?
He doesn't seem too concerned. He's a happy child.
What have you done to resolve the problem so far, if anything?
Jimmy, he has been on the waiting list for ages, enrolled in special reading program, but he has shown no progress.
In our research of existing case histories, these questions are the most common to ask. They would be helpful in planning for assessment and narrowing in on specific areas of deficits. Because the mother's concerns were mainly with literacy and learning, we thought that asking about NAPLAN would make it more specific and able to be measured.
And just some questions about Jimmy's activities. Does Jimmy enjoy reading and writing letters, or does he like cognitive games? or does he prefer outdoor activities or electronic games?
He enjoys Minecraft and he always plays it on the TV.
Yeah.
Otherwise, he's on his iPad playing games.
And have you seen Jimmy interact with his peers, and what is he like?
Jimmy has a few friends and he doesn't seem to enjoy interacting with other children. I'm concerned about him going to high school because there is going to be more children there and he'll have even more difficulty making friends.
And just some closing questions. So, what do you hope to get out of these sessions?
I want to know the best possible way to help Jimmy recover from his language problems and really help him make a smooth transition to high school.
Okay. Well, that's it for the questions. Thank you for answering everything.
We specifically asked questions about his interests so that we would be better prepared ourselves for our one-to-one time with him and to be able to help build rapport. Asking the mother first about this allows us to jump straight into those topics with Jimmy without fussing around with other things. We didn't ask too many though because most of this will be left for our conversation and language sampling with Jimmy himself.
Hi Jimmy, how are you? We're going to have a little chat today and we're going to get to know each other. Is that okay? What grade are you in school?
Grade 5.
And what's your favourite subject?
I like computer class because Mr. Bob is really nice and he lets me play on the computer. He's nice and not mean like Mrs. Jones.
Why is Mrs. Jones mean?
She's always picking on me because I can't read good and she's scary. I don't like English class.
Do you do any co-curriculars at school? What do you usually do for lunch?
Just go on my phone and eat.
Who's your favourite person at school?
Ryan, because he always shares his lunch with me and we always play Minecraft together. I like Ryan.
Oh, that's nice. So do you and Ryan have classes together?
No.
So who do you ask when you have questions about schoolwork?
No one.
So do you hang out with Ryan on weekends?
We play Fortnite.
So you go to Ryan's house or he comes to yours?
We play online. I don't always get to use the Xbox because Tim's on it and I don't always get to talk to Ryan, so I'm sad.
So do you and Tim play together?
No, he doesn't talk to me because he's a big kid.
So will you be going to the same high school as Ryan?
No,
Why is that?
because he's not.
I'm sorry to hear that. I'm sure you'll make lots of friends in high school. How do you feel about going to high school?
I don't want to go to school because there's big kids and they're mean and scary.
I have a son in high school and he was scared to go to school too, but after the first day he made heaps of friends and he's really happy to go to school now.
Does he play Fortnite too?
He plays Fortnite and Minecraft, but he also loves reading and playing sports. Do you play any sports?
No, I hate sports and PE class.
Do you like reading any books?
No, I don't like reading because it's hard.
Why do you think reading's hard?
Because I can't always read the big words and there's no pictures in the book, so they're boring.
Does your teacher help you with reading in class?
No, I hate Miss Jones. And she's too busy yelling at everyone.
Why do you like Mr. Bob more than Mr. Jones?
Because Mr. Bob is really cool and he knows all about computers.
Computers are really fun and it sounds like you're really good at them. Maybe you could teach me how to play Fortnite the next time you come in. Should we get your mum back in and have a little chat to her?
Okay.
The main purpose of our interview with Jimmy was to find out his interests and his likes or dislikes, in order for this to inform how we later plan and conduct our assessment of him. Any medical, demographic and developmental information was gathered from the interview of the mother, so therefore not necessary to ask towards him. We aim to build rapport as he's a client that we are actually treating and wanted him to feel as comfortable as possible with his speech pathologist.
With regards to my reflection on my role as a speech pathologist in Jimmy's case, I felt that I could have engaged him in conversation more effectively by asking about his interests and building on them. While preparing interview questions for Jimmy, I decided to focus on his interests, which we decided were computer games and his friend Ryan. However, when we were formulating the questions, we did not delve too deeply into his responses and asked some unrelated questions about his teachers and his experiences in school. This could have caused Jimmy to feel disengaged and like he wasn't really being listened to, which could have led him to being more closed off in future sessions. While it is good that we tried to get a general overview of Jimmy's life and daily activities during the interview, it would have also been effective for us to focus on some of his interests more deeply and develop intervention activities based on his answers. In the future, we could have interviews that are more engaging and help the client to speak about their interests in a comfortable setting. This would reduce the anxiety that therapy can cause and also allow speeches to develop an intervention plan that is tailored to the client's interests.
As the speech pathologist, while conducting the interview, I noticed it was hard to build rapport with the client because I was asking a lot of questions which required me to look at my notes. By preparing beforehand, I could have memorized the questions, so I had a general gist of the questions and didn't need to rely on the notes as much. Instead of just moving on to the next question, I could have also asked the client to elaborate more and given more of my own responses to their answers in order to create conversation. I also think it is important to ask more open-ended questions about what the client or what the child or the parent thought they were there for and what issues they specifically think need addressing. And once they've answered this question, being flexible to ask follow-up questions regarding their concerns and not just note it down and move on to the next question. This would make them feel more listened to and understood. If the client walks away from the consultation feeling as though they didn't get everything off their chest that they wanted to, they will always be doubting whether you really understood them and their issues.
To improve our interview, we could have had our speeches better identify themselves. An article by Young and Duggan recommended the importance of the beginning of an interview in building rapport. For example, being clear and saying, "Hi, my name is Rachel, I'm a speech pathologist," maybe elaborating on what that is exactly, and I would like to ask you some questions today about your language, and then asking, "Is that okay with you?" Especially for child patients, this makes it clearer to them when they may have been a bit confused as to why they were there in the first place. Also, asking specifically if you can ask them questions gains consent and makes them feel more involved and aware and less forced. Another good question, possibly more for older patients when starting an interview, is, "What would you like me to call you?" This makes sure that they feel comfortable and makes things a bit more personal, allowing them to open up more. I think it's also important to discuss the length of our interviews. The parent interview alone had 44 questions, which in a clinical setting where time is limited, I think this may be unrealistic. It may be better to have less questions that are more open-ended so that it directs the conversation but allows the parent to say everything that they think is important. I doubt the necessity of the birth-related questions, and so realistically I think most of these could have been removed.
Having school-aged clients, it's important to take their family life as well as their school life into account. The parent of our 11-year-old male client had concerns about his speech, language and learning, which arose because he was about to go to high school. So I think we did well in centering the majority of our questions to the client around school rather than to the parent. And by that, we were able to figure out his real problem, which in this case was his shyness. For me, role-playing as the 11-year-old boy was quite challenging, as I wasn't sure how to portray a child that has speech, language and learning difficulties. However, as we decided on his socio-economic background and personality, becoming the client was easier to portray. This made me realise the importance of knowing a client's overall background to improve rapport. In a real-life client's clinical setting, I will definitely have to take into account the background questions and answers when trying to build rapport with the client.
It's important for the parent to answer the speech pathologist question with much detail as possible, as it is known that parent interview can produce positive changes in both the outcomes and attitudes of therapy. Also, the level of information provided by the parent can determine how the speech pathologist plans out the assessment plan with the child. However, some of the answers which I gave as a parent were very short and brief, meaning that the parent interview was missing components which could have helped the speech pathologist planning out the most beneficial method of assessment for the child. For example, when asked about whether Jimmy received any special services, I answered that it didn't help him as much as I hoped it would, without further elaborating on it and going on to discuss which treatment approaches worked and didn't work for Jimmy. At the end of the interview, I was reminded of the importance of the parent in providing relevant information to assist the speech pathologist decide on intervention goals and strategies.
In hindsight, some of the questions that were asked to the mother may have seemed a bit insensitive to ask somebody in person the first time you meet. But since we had constructed our child as an 11-year-old boy from relatively low socio-economic status, in accordance with research by Rogosh, Dacus and Cicchetti, it was highlighted that children of this demographic often exhibit weakness across neurocognitive functioning and performance domains that are important for academic achievement, and these were specific areas the mother had expressed concern in. Along with this, a combination of deprivation, lack of cognitive stimulation, and exposure to high levels of environmental stress can cause serious deficits in the speech and language development of children. Thus, though some of these questions may have seemed insensitive, they were necessary to get a greater idea of the client's case history and then how that may explain their current level of speech and language. In a real clinical setting, I would personally find these kind of questions quite difficult and hard to ask, so it would be beneficial to develop a more efficient way to establish this information while still showing empathy.